Hello everyone, you're welcome to my YouTube channel. This is Next Stephanie. Okay, in today's video we're going to be talking about congestive heart failure or heart failure, its causes, signs and symptoms, and ways to manage and prevent this heart failure. Okay, so what is congestive heart failure or heart failure? It is a life-threatening condition which occurs when the heart does not pump enough blood to meet the body's metabolic requirement. Okay, this congestive heart failure is actually, it can be classified in two types. You have the left-sided heart failure and the right-sided heart failure. What actually occurs in the left-sided heart failure is this: it actually affects the left lower chamber of the heart, that is the left ventricles of the heart, which lead to the backup of fluid into the lungs, which causes shortness of breath. Okay, then for the right sided heart failure, it actually affects the lower right chamber of the heart, which is also known as the right ventricles. So in here, it actually leads to the backup of fluid into the abdomen, the leg and the feet, so which actually causes swelling. Okay, we're going to move now down to the causes of this heart failure. But first, before we dive into that, please, if you're new in this channel, do well to subscribe and also ring the notification bell for more of these videos, and please do well to share and like my videos. Thank you. Okay, so what are the various causes? What actually causes this heart failure? First, we have coronary artery disease. This is the most common cause of heart failure. Yeah, the arteries, that is, yeah, it is the build up, it results from the build up of fatty deposit in the arteries, which narrows the arteries and also reduce the blood flow. Okay, second, we have heart attack. Yeah, it is actually caused by complete blockage of the artery that supplies to of the artery that supply blood to the heart. In the third, we have hypertension, which is actually high blood pressure. Yeah, the heart is being forced to work harder. The heart is being forced to work harder than as usual to pump blood through the body, and so over time this hard work of the heart can causes muscles stiff. The muscles of the heart become stiff and weak to pump blood properly. Okay, the next we have myocarditis, which is actually inflammation of the muscles of the heart. The muscles of the heart become inflamed, and if they become inflamed, it can definitely causes heart failure. Okay, the next we have congenital heart defect. This is actually what you are being born with. Like, there are people who are actually born with congenital heart defect. That is, when this occur, when the heart and its muscles or the valves doesn't actually form correctly, so other parts of the heart actually work hard to pump blood, so which can definitely lead to heart failure. Other disease condition, like you have diabetes, you have obesity, you have HIV infection. All these, they're long lasting, or they're long lasting diseases which can cause chronic heart failure. The last one we have are some drugs. That is, these are drugs that you take for a very long time. It can definitely lead to heart failure. Example, we have non-steroidal and anti-inflammatory drugs. Example, aspirin. Okay, then we're going to move down now to what are the signs and symptoms of. First sign and symptom is you have shortness of breath when doing an activity or when lying flat on the bed. Okay, the next we have weakness and fatigue. Next we have cough that does not get finished, or cough that brings up white or pink mucus with spots of blood. Okay, the next we have wheezing. The next we have rapid or irregular heartbeat, and then we have tachypnea. Next we have a very rapid weight gain. That is, you just keep on increasing weight due to build up of fluid in the body. Then next we have swelling of the abdomen and discomfort. Then the last we have swelling of the legs, the ankle and the feet. Okay, so those are the signs and symptoms of heart failure. All right, what are the various ways in which we can manage this heart failure? First, you reduce salt intake. The second, we have you do moderate exercise. The third, you manage stress. The fourth, you actually take drugs as prescribed by the physician. You make sure that you follow your drugs and make sure that you go for checkup. You make sure that you go for checkup oftenly. Then the last, which is the fifth, we have you try to lose weight. You try to maintain a healthy weight and also eat healthy food. Okay, how can we prevent this heart failure? First, you make sure that you treat and control all what causes this heart failure. Example, like coronary artery disease. You make sure that you treat it. In the process of treating it, you can actually prevent heart failure. You also treat diabetes. You also make sure that you follow up with your treatment for diabetes to prevent heart failure. Obesity, you do same and reduce weight gain. And that is, you reduce weight gain by maintaining a healthy weight to actually prevent this heart failure. Okay, so that is all what we have for today video. Thank